My name is Justin C. Brown. I'm a physician at Charlotte Eye, Ear, Nose, and Throat. I had an uncle who I was close with who was blind from diabetic retinopathy. And in addition to that, on the other side of my family, I had a cousin who did the national fundraising for the old Retinitis Pigmentosa Society. So when she would do fundraising, she would always bring around visually impaired people who she was trying to raise money from. So I became very comfortable with the visually impaired growing up, and I think I naturally gravitated towards that once I got to medical school. During undergrad, I volunteered in the emergency room at University of North Carolina hospitals, and it made me feel really good when I would leave after volunteering there in the emergency room. At the time, I thought I might be interested in emergency medicine. And I started to think if I can leave work every day for the rest of my life feeling good, like I did something meaningful and helped people, that I would have a good life. So I think ultimately that's why I made the decision. Did my undergrad at University of North Carolina and stayed on for medical school there. So I was there for a total of 8 years. And then through the residency matching program, I matched up at Johns Hopkins University for my internship and residency. So I was up there for another 4 years doing that, and stayed at Hopkins for an additional 2 years to do a fellowship in vitreoretinal surgery. A year after that, I did the chief residency there, which was also combined with an ocular trauma fellowship. I have 6 children, which take up most of my spare time. But when I can, I read a lot, mostly fiction, but some nonfiction. To try to work out as much as possible. So I lift some weights and get on an elliptical. I used to run, but I have arthritis in my hip. So try to stay in shape, spend a lot of time with the kids and reading.